Good day, everyone. This is the topic we're going to tackle today, and it's about the clinical symptoms and disorder of the skeleton. First is osteogenic sarcoma, a malignant bone tumor. Fracture, a break in the bone. In a closed simple fracture, the broken bone doesn't penetrate the skin, while in an open fracture, there is an accompanying wound in the skin. Paget disease, a chronic disorder that causes bones to grow larger and become weaker than normal. Protrusion of the center of an invertebral disc into the spinal canal. It is also called rupture or slip disc. Rheumatoid factor, a collection of antibodies found in the blood of people with rheumatoid arthritis and other systemic disease. Ankylosing, immobility and fixation of a joint. Lordosis, an exaggerated curvature of the spine in the lumbar region, also called as humpback. Osteomalacia, a disorder of bone softening in adults that is usually due to prolonged deficiency of vitamin D. Spondylosis, denigration of the articulating portions of the vertebrae allowing for spinal distortion, specifically in the lumbar region. Ankylosing spondylitis, a chronic progressive inflammatory disease involving the spinal joints and surrounding soft tissue, most common in young males and also called as rheumatoid spondylitis. Gout. Gout is a type of inflammatory arthritis that causes pain and swelling in your joints, usually as flares that last for a week or two and then resolve. Gout flares often begin in your big toe or lower limb. Rheumatoid arthritis, an autoimmune and inflammatory disease. Osteopenia, a loss of bone mineral density that weakens bones. Osteomyelitis, a serious infection of the bone that can be either acute or chronic. Rickets. Rickets is the softening and weakening of bones in children, usually because of an extreme and prolonged vitamin D deficiency.
Spondylolisthesis, a forward displacement of one or more vertebrae. Kyphosis, an exaggerated curvature of the spine in the lumbar region, or also called swayback. Osteoporosis, a bone disease that develops when bone mineral density and bone mass decreases, or when the structure and strength of bone changes. Osteoarthritis. Osteoarthritis is caused by damage or breakdown of joint cartilage between bones. Arthritis, inflammation of a joint. Scoliosis. Scoliosis is a sideways curve of the spine. Sciatica, severe pain in the leg along the course of the sciatic nerve, usually related to spinal nerve root irritation. Chondrosarcoma, a malignant tumor of cartilage. Curvature of the spine. An exaggerated spinal curve such as scoliosis, lordosis, or kyphosis. Pat disease. Inflammation of the vertebrae usually caused by tuberculosis. Degenerative joint disease. Osteoarthritis is a degenerative joint disease in which the tissues in the joint break down over time. Osteochondrosis, a self-limiting developmental derangement of normal bone growth primarily involving the centers of ossification in the epiphysis. Bunion, a painful bony bump that develops on the inside of the foot at the big toe joint. Bunions are associated with hallux valgus, a condition where the big toe drifts toward the smaller toes and outside of the foot. Hammer toe. The location of the toe joints changes, giving the toe a claw look like and causing the first joint to thrust upward, causing the irritation and pain when walking. Ewing tumor, a bone tumor that typically occurs in younger age 5 to 15 years. It starts in the shaft of a long bone and quickly spreads to neighboring bones. It may respond to radiation therapy, but it will eventually recur, also known as Ewing sarcoma. Exostosis, a bony outgrowth from the surface of the body. Subluxation, a partial dislocation of a joint. Osteoma, a new piece of bone usually growing on another piece of bone, typically the scalp. Valgus, a lower leg deformity that exists when the bone at the knee joint is angled out and away from the body's midline. Bursitis, inflammation of the bursa. A bursa is a closed, fluid-filled sac that works as a cushion and gliding surface to reduce friction between tissues of the body. Multiple myeloma, a cancer that forms in a type of white blood cell called a plasma cell. Giant cell tumor, the ends of the bones are destroyed commonly at the knee by large mass that does not metastasize. It is commonly found in children and young adults. Hallux valgus, a painful condition characterized by the literal displacement of the great toe at the metatarsal joint. There is also metatarsal head enlargement and bunion development. Osgood-Schlatter disease, a condition that causes pain and swelling below the knee joint where the patellar tendon attaches to the top of the sine bone or tibia, a spot called the tibial tuberosity. Heberden knots, small hard nodules formed in the cartilage of the distal finger joint in osteoarthritis. Hemarthrosis, bleeding into a joint cavity. Baker cyst, a fluid-filled sac that forms in the popliteal fossa, which is located on the posterior aspect of the knee. Osteochondroma is an overgrowth of cartilage and bone that happens at the end of the bone near the growth plate. Varus is a condition that causes your legs to turn inward. Spondylosis is a condition in which there is abnormal wear on the cartilage and bones of the neck, which is cervical vertebrae. Carpal tunnel syndrome is a numbness and weakness of the hand caused by pressure on the median nerve as it passes through a tunnel formed by carpal bones. Osteogenesis imperfecta, which is disease which bone fracture break easily, often with no obvious cause or minimal injury. Von Recklinghausen disease, a genetic disorder characterized by the growth of tumors on the nerves. Callipes is a foot abnormality in which the foot points downward and inward. Chondroma is a benign tumor of cartilage. Achondroplasia is decreased growth of cartilage in the growth plate of long bones resulting in dwarfism, a genetic disorder. Reiter syndrome, a form of arthritis that affects the joints, eyes, urethra, the tube that carries urine from the bladder to the outside of the body, and skin. Osteodystrophy, abnormal changes in the growth and formation of bone. Neurogenic Neurogenic arthropathy is a form of arthritis where the cartilage between bones has completely worn down and the joint has been severely damaged from continued friction.